Welcome to the webinar today. Advanced slide. We'll begin talking about CQL accreditations. More than 350 organizations have achieved CQL accreditation, including 25 states in the US, from Tennessee to Maryland and Canada, Ireland, and New Zealand. CQL has partnered with individual providers and governmental agencies all over the world. This has resulted in the expansion of best practices and implementation of cutting-edge approaches internationally through organizations engaging in CQL services and offerings. Accreditation support organizations to align quality assurance models, build consistency in standards, and utilize internationally recognized tools, share best practices while demonstrating person-centered commitment, improving quality of life, strengthen quality of services, collecting and evaluating meaningful data, and it's used for external validation, including things such as state, provincial surveys, and audits. As Peter Drucker, author, consultant, one of the foremost business management authorities once said, if you can't measure it, you can't manage it. As I said, the Basic Assurances tool evaluates successful operations involving the health, safety, and human security of people receiving services, as well as areas such as natural support, social networks, employment, and much more. Alignment with the Basic Assurances is a prerequisite for being in business in our field, and organizations unable to meet the requirements are not permitted to operate as a public or private entity. So by identifying evidence of practices that demonstrate the system's effectiveness, the tool ensures the organizational policies, procedures are actually delivering results. Organizations can collect data through the Basic Assurances to analyze systems and practices and track the progress of their initiatives over time. When we think of our proprietary tools, the Basic Assurance tool is to evaluate the essential, fundamental, and non-negotiable requirements of all human service organizations and systems. Personal outcome measures, or the POM, is a person-centered discovery process, exploring the presence, importance, and achievement of outcomes, along with the supports that help people achieve those outcomes. Shared values create an alignment between organizational values and organizational behavior through factors, indicators, and probes. CQL believes in community life that we define quality in the context of community. As I said, for Basic Assurances, we evaluate successful operations involving the health and safety and human security of people receiving supports and services, as well as natural supports and social networks. The FAA has one level of safety, and there is no compromise. The airlines that meet it can fly. Those that can't become part of a business school case study. And this is what happens to airplanes and airlines that aren't safe. They either comply, excel, or fail. And none of us like that. In brief, the Basic Assurances go far beyond compliance with licensing and certification standards. The Basic Assurances look at the provision of safeguards from an individual perspective, where the effectiveness of the system or policy is determined in practice, person by person. They're non-negotiable, essential, fundamental, just like the FAA. They're requirements for all service providers. It includes health, safety, and human security. And what's different is it's viewed from the person's perspective. Through 10 factors, 46 indicators, and hundreds of probes, the Basic Assurances provide organizations with guidance for ensuring that systems translate into actual practices to positively impact the lives of people. The structure includes these three areas. Factors refer to the main topic areas of the Basic Assurance, which encompass critical aspects of quality and human services. Indicators set expectations for each factor of the Basic Assurances and describe the general standards that need to be met, and probes include specific questions or criteria to evaluate if an indicator is present. We look at Basic Assurances in two ways. First, we ask, is the system in place? Here we're looking for the evidence of sustainability. It might be policy, procedure, or even staff training. Second, is the practice in place, and does it really work for the person? We watch for the evidence in daily interactions and find out from the person's perspective if the system really works. In this webinar, we'll discuss why it's important to collect data, how you'll use data that is available to help you make any point, and how data becomes supporting evidence of the story you will build and tell. We'll discuss who the audience is and what you need your audience to know. And finally, we'll listen to partners' perspective around data and summarize the material we present today.
So let's think about the why. What value will using data bring to your organization and the people that you support? Using data effectively can bring value to organizations both large and small. The 2011 film Moneyball is a great example of how utilizing data can increase efficiency, maximize effectiveness, and do more with limited resources. In 2003, the Oakland Athletics were one of the lowest payroll teams in Major League Baseball. General Manager Billy Beane used data to identify players that could bring value in wins. Many of these players had been cast aside or overlooked by other teams, but the Athletics in their analytics were able to see the potential that other teams did not. Despite their low payroll and against all odds, the Athletics ended up winning 103 games and making the playoffs. Now, for those of you who know nothing about baseball, trust me when I tell you, winning 103 games is really great. It really puts you among the elite. The potential for data to make organizations great is certainly not limited to sports. Through the accreditation process, CQL supports organizations to use data in ways that could bring value to the entire organization. Data is all around us, and you are using data every single day in ways you might have never realized. Let's take a minute to think about how you interact with data throughout the day. Have you ever used a smartwatch to count your steps? Have you ever looked at your credit card statement or credit card app to figure out where all your money has gone? Have you ever checked your weight on a scale or counted calories? What data do you see on the dashboard of a car? How fast are you going? How much fuel are you using? How far to your destination? Has a video streaming service such as Netflix ever recommended a show or movie based on your viewing habits? What about the ads showing up in your social media feed? These are ads based on data collected about your browsing habits or your search history. This data has the potential to keep us healthy, safe, entertained, and can provide us with a higher quality of life. Data can bring a tremendous amount of value to our organizations and the people that we support. Data will help you to improve quality of life for people you support. Improving quality is first and foremost among the reasons why organizations should be using data. By allowing you to measure and take action, an effective data system can enable your organization to improve the quality of people's lives. Data allows you to monitor the health of important systems in your organization. By utilizing data for quality monitoring, organizations are able to respond to challenges before they become full-blown crises. Effective quality monitoring will allow your organization to be proactive rather than reactive, and will support your organization to maintain best practices over time. Building an effective system in this area does take some work, but will create efficiency over time. Data allows organizations to more effectively determine the cause of problems. Data allows organizations to visualize relationships between what is happening in different locations, departments, and systems. If the number of medication errors has gone up, is there an issue such as staff turnover or vacancy rates that may suggest a cause? Looking at these data points side by side allows us to develop more accurate theories and put into place more effective and creative solutions. Data allows you to replicate areas of strength across your organization. Data analysis will support you to identify high-performing programs, service areas, and people. Once you identify your high performers, you can study them in order to develop strategies to assist programs, service areas, and people that are low performing. Good data allows organizations to establish baselines, benchmarks, and goals to keep moving forward. Because data allows you to measure, you'll be able to establish baselines, find benchmarks, and set performance goals. A baseline is what a certain area looks like before a particular solution is implemented. Benchmarks establish where others are at in a similar demographic, such as POM national data, personal outcome measures. Collecting data will allow your organization to set goals for performance and celebrate your success when they are achieved. Funding is increasingly outcome and data-driven. With the shift from funding that is based on services provided to funding that is based on outcomes achieved, it is increasingly important for organizations to implement evidence-based practice and develop systems to measure these outcomes. Your organization probably already has most of the data and expertise you need to begin this analysis. Your HR office probably already tracks data regarding your staff. You are probably already reporting data regarding incidents to your state oversight agency. Later in this webinar, we will drill down and look at some of the data that you might consider collecting and analyzing. CQL does have a resource titled 12 Reasons Why Data is Important. We will include that link in the chat box. Data will talk to you if you're willing to listen to it. We can use data to evaluate the relationship between different things that may not have an obvious relationship. This allows us to become more effective and proactive and use limited resources more efficiently. As an example, people who choose where and with whom to live had a 74% decrease in ER visits compared to those who did not choose where and with whom to live, regardless of their demographics. In another example, people who experienced DSP turnover had more emergency department visits, instances of abuse and neglect, and injuries than people with IDD who did not experience turnover. For example, controlling for support needs, people who experienced turnover visited the ER 2.14 times in a year, whereas people who did not experience turnover visited the ER 0.84 times in a year. People with IDD who were connected to natural support networks had significantly higher quality of life compared to people who were not connected to natural support networks, regardless of their support needs or other demographics. People with IDD who were connected to natural support networks had significantly lower service expenditures compared to people who were not connected to natural support networks. If you're interested in learning more about our research and how we use data as CQL, please visit the research section of our website. We will post that link in the chat box as well.
Tell me the facts and I'll learn. Tell me the truth and I'll believe. But tell me a story and it will live in my heart forever. So again, why is using data important? Well, because communicating data has impact and shows progress. And the power of progress is fundamental to human nature. And honestly, because celebrating wins is crucial to company culture. Data helps you make better decisions, help you solve problems. Data helps you understand performance, helps you improve processes. Data helps you understand people you support, families, employees, stakeholders. And it also tells a story. When we exchange stories, we build a common ground of experience. Stories move us to feel and stories move us to act. However, storytelling is not an inherent skill, especially when it comes to data. When you see a great play, watch a great movie, or read a great book, you experience the magic of a story. So stories have a shape and start with a plot that really is a chain of connected events that make up a narrative. For example, what's the basic information or data that your audience needs to know? In this story, the plot is DSPs are critical for us to provide services, and we are important for us to know what types of services they want. Positive culture shape appreciative inquiry. Appreciative inquiry is not trying to change people. It brings people together to collaboratively change their organization. So whenever you tell a story, you start with a good plot, you have a lot of fun twists and turns. You might be doing research, you might be doing assessments, you might be having focus groups. You learn from that experience, and then you make some decisions. Well, we have some good data. What are we going to do with the data? Some of it we're not doing things well in our organization. Other things we're doing really well. So ensure that you're looking at your story. Start with a plot, have a good lots of twists and turns, and stick your landing. Positive cultures truly are shaped through appreciative inquiry.
CQL uses concepts of appreciative inquiry in evaluating organizations. Our focus is not deficits, and accreditations will never result in deficiencies. Rather, CQL partners with organizations to identify opportunities to continue moving forward in the best way possible. So what is appreciative inquiry? Some of you might already know. At its heart, appreciative inquiry is about the search for the best in people, their organizations, and the strengths-filled, opportunity-rich world around them. Appreciative inquiry is not so much a shift in the methods and models of organizational change, but a fundamental shift in the overall perspective taken throughout the entire change process to see the wholeness of the human system and to inquire into that system's strengths, possibilities, and successes. Your system for quality should not only allow you to respond to deficits, but enable you to be more proactive and replicate strength across your organization. We understand that developing a system for integrated quality management can feel overwhelming. CQL partners with organizations around the world to build effective systems to collect, analyze, and respond. Let's talk about how to get started. At a very basic level, we need to develop a system that allows us to measure the effectiveness of all of the different systems we have in place at our organization. Your first step might be the development of a policy and procedure that maps the data that you will collect in relation to important systems. The basic assurances provide a good basic structure of these systems. Data points and measurables can be connected to each of the basic assurance factors. An effective system will have a delegation of responsibility and accountability for collection and should not create a whole lot of additional work. Start with the data you already have and allow the system to evolve over time. Consider the development of a quality committee or similar with broad representation from across the organization's programs and systems that will serve as the primary group responsible for analysis and recommending action. It is important to have a written strategy that will map how you measure quality at your organization. This strategy will also support you to prevent data silos. Your approach should be holistic, interconnected, and enable the evaluation of data from across systems, programs, and people. Here are some examples of what you should consider as part of your strategy, policy, and procedure. The data that you collect. The basic assurances provide a convenient framework to organize your data. What data do you have that will help you to measure how people exercise their rights? What data do you have that helps you to evaluate health and safety? A little bit later, we'll drill down and make some recommendations about what data you might collect in each of these areas. Think about the sources of that data. Consider all of the systems you already have in place and all of the data you are already collecting. Do you have an incident management system? Do you have an HR or timekeeping system? Do you use financial reports? Oops, sorry. You probably have most of the data that you need to be successful. Think about the who. Who will collect this data? It is important to create accountability for who is responsible for the collection and reporting of your data. Establish timelines and frequencies for collection and action, and who will act and respond to the findings in your analysis. It is important to set goals. Examples might include reducing injuries or other incidents, increasing the extent to which people are exercising rights, or supporting people to have more meaningful social roles.
You'll note on this slide, we've included Kotter's 8-step model. Some of you may have heard of this. John Kotter is internationally known and widely regarded as the foremost speaker on topics of leadership and change. In his book, Leading Change, he reveals why change is so hard and provides actionable 8-step process for implementing successful transformation. You know, CQL's mission, we're dedicated to the definition, measurement, and improvement of personal quality of life. In fact, in Factor 10 of CQL's basic assurances, we ask, do people, families, and support staff actively participate in collecting and analyzing data used to evaluate basic assurances? When you think about data in your organization, who's in charge? Who's in charge of that data? Is it the database manager, the data analyst, or is it someone who is simply good at it? The newest dilemma organizations face concerns how to include the rest of the staff, people supported families, and other stakeholders. Collecting and analyzing data should not really occur in a vacuum. Data affects everyone else and a broader range of people. People who need to have the ability to identify, understand, interpret, and communicate with data. And this may be a big change for many. So this 8-stage change process is helpful to look at how you might lead this change. He discusses create a sense of urgency and develop a sense of urgency around the whole idea of needing to change to look at data, form a powerful coalition, convince people that change is really necessary and why. Create a vision for change, something clear that people can understand what you're asking them to do and why. Communicate your vision. What do you want to do with your vision after you create it to determine your success? Remove obstacles. Is there resistance to change? Are there processes in the way? Create short-term wins. Nothing really motivates more than success, so celebrate short-term wins. Build on the change. Quick wins are only the beginning of what needs to be done. So achieve long-term change. You want to encourage people to have short-term wins, but recognize that there's still a road ahead to work on. And then anchor the change in corporate culture. Finally, to make any change stick, it should become part of the core of your organizations. Build successful partnerships. In the book, Power of the Moment, the authors describe deepening ties through deepening moments of connection. They suggest that to spark moments of connections for groups, it's important to create a shared meaning. Connecting to meaning, reconnect people for the purpose and efforts. In thinking about quality management for a smaller organization, CQL's shared values is a good tool to use, and you can see the shared values factors listed on this slide. Organizations represent a collection or community of people who come together to accomplish the work of the organization. These organizations or communities can be large, small, formal, or informal. Organizations can include small voluntary associations, self-help groups, individual citizens, small businesses, or large public or private agencies or corporations. Organization function as bridges for people for their communities. Using data, the who. Before you start down that path of creating a PowerPoint data presentation, there are a couple of things you want to be able to answer. Who's your audience? What do you need them to know? The more specific you can be about who your audience is, the better position you'll be in for a successful communication. It's also helpful to think about the relationship you have with your audience. Is it a first time you're meeting people, or do you already have an established relationship? In the who, we'll discuss building communication strategies around data, defining your audience, and the importance of who you will show what data to. We will introduce you to a 3-minute story and discuss with you why all graphs really are not equal. What is a communication strategy? Put simply, a communication strategy is a roadmap, a message for getting things delivered. A communication plan will be specifying major components, why and how and what information is important to be delivered to the project, who is in charge of delivering information, what's the time frame and frequency for the information distribution. And remember, not all projects are created equal. Therefore, communication strategy will specifically correlate to each individual project. Small projects will have different communication needs than larger projects. For example, a small project may have a single main contact versus a large project may have stakeholders, key players, and so on involved. Stakeholder involvement. Stakeholders are people or entities that have vested interest in the organization and can either affect or be affected by the operations or the performance of organizations. Talking with people about data is like telling a story. There is a storytelling in your data, and you must know who you're telling your stories to. And the foundation of a great story starts with knowing the audience. When we tell stories using data, we're not telling a story just for the sake of telling a story. We're telling a story in order to achieve a certain goal. The point is that using a story is a strategic decision, and you want to be able to leverage that story. So in order to do that, you have to know who you are telling that story to. Consider who should be part of the conversation. As self-advocates say, nothing about us without us. It's important to remember what may seem self-evident or obvious or even common knowledge to us may not be common knowledge to others. It's important to consider what the audience might not know, and it might be necessary to share that with them, because otherwise you may have some resistance or discomfort with the audience if you share something with them or talk in a way that they don't know what you're talking about. Common language is not so common because we often speak in our jargon. Every profession has their own jargon, so we need to lose the jargon. Too often people pretend to know something, so in their minds, they don't want to look stupid, so they're not going to say anything. So in presenting data, you might consider asking questions like, does that make sense? Shall I define it more? Different communication must be used for different audiences. I referenced the book Power of Moments, and here's a quote from one of the authors. Data are just summaries of 1,000 stories. Tell a few of these stories to help make the data meaningful. Using data, the what, now that we've answered the why and the who, the what becomes easier to identify and to articulate. Once the audience has identified, you need to know what you need for them, what you need from them, excuse me, and what you need the audience to know or do. You always want your audience to know or to do something. So let's think about summarizing the communication as the single most important message. To that end, I want to share a few concepts with you. The 3-minute story. A 3-minute story is exactly what it sounds like. If you had only 3 minutes to tell your audience what they need to know, what would that sound like? From the book Storytelling with Data, the author suggests that the 3-minute story is a great way to ensure you're clear on and can articulate the story you want to tell. Being able to do this removes you from dependence on your slides or visuals for a presentation. This can also be helpful in a situation where your boss unexpectedly asks you what you're working on, or you want to give a group a quick rundown to get their feedback. Or how often have you been in a situation when you're out of time in the meeting? You know exactly what you want to say and communicate, and you can make it fit into any time slot you're given, even if it's not the one you planned for. The big idea boils down to the so what of your overall communication. Even put it down to a simple sentence. The big idea has 3 components. It must articulate your unique point of view, it must convey what's at stake, and it must be a complete sentence. For storyboarding, there is not a need to use presentation software for this. So go low tech, use a whiteboard, Post-it notes, or just plain paper to use your big idea to create a story. All graphs are not equal, and just because you have numbers does not mean you need to build a graph. From the webpage Storytelling Data, the author writes, when we think of showing data, typically our brains go first to tables and graphs. But let's not forget about simple text. When you have just a number or two, showing the numbers themselves can be much more powerful than burying them in a table or graph. Beyond potentially misleading or doing so, putting just a couple of numbers into a table or a graph causes them to lose their oomph. First, think about what you want your audience to know, what they don't know, and what you want them to know. Confusing, right? The right graph for the situation will always be the same, whatever will be easiest for your audience to read. Clutter really is the enemy of clarity. Clutter is a visual and can make something feel more complicated than it actually is. Choosing an effective visual is important to make clear what kind of process you want to show. So think about what your audience is going to do with the data and create a visualization that will allow this to happen easily. Highlight the important stuff through caps, bold, italics, size, eliminate distractions because not all data is equally important, and get rid of the non-critical data or components. We all want to show our hard work, but you also want to get the point across. This is make sure the visual is accessible and make sure it's usable for people with diverse abilities. And yes, make it pretty because pleasing visuals that are aesthetically pleasant are actually perceived to be easier to use. So what information is relevant and essential? As I said on the previous slide, eliminate distractions. Not all data is equally important. Get rid of the non-critical data or components. So what is relevant and essential? Qualitative versus quantitative data. Well, qualitative data is description information about characteristics that are difficult to find or measure or can't be observed numerically. It's collected using questionnaires, interviews, or observation, and frequently appears in narrative form. Quantitative data is numerical information that can be measured or counted. The data is usually gathered using instruments or questionnaires, which includes rating scales, a thermometer to collect weather data. Visualization does mean something, and there's an important difference between exploratory and explanatory analysis. Exploratory analysis is what you do to understand the data and figure out what might be noteworthy or interesting to highlight to others. It's nice to share with people all the hard work that went into getting your analysis, and we all want to do that. But when you're at the point of communicating your analysis to your audience, we really want to be in an explanatory space, meaning you have a specific thing you want to explain, a specific story you want to tell. Deming said, if you don't know how to ask the right question, you discover nothing. Another way to think about this is the quality of the answers you get is directly based on the quality of the questions that you ask.
The personal outcome measures allow us to examine quality through the perspective of each person receiving services. Information gathered through this tool can be utilized as part of the person-centered planning process, and data can be aggregated and analyzed in order to identify organizational strengths and opportunities. Portal is a secure online data system that incorporates CQL's personal outcome measures and basic assurances to collect and evaluate data. The collection of data and the ability to generate reports available through the Portal data system will assist organizations in making sound decisions to improve the quality of supports and quality of people's lives. Access to Portal is completely free for organizations that have achieved CQL accreditation for the duration of their accreditation term. The basic assurances provide a convenient framework for your data. Let's examine some of the data that you might consider collecting in relation to each of these areas. Remember, these slides will be available for download later on, so don't feel like you have to write vigorously to capture everything that we say today. So again, a look at the basic assurances. The basic assurances are divided into 10 different factors and focus us on rights, relationships, safety, health, staff, positive supports, security, and quality improvement. To get started in building or improving a quality management strategy, we recommend linking key data to each of the basic assurances factors. This will allow us to measure each of these critical systems within our organization. For each of the following slides, we would like to hear from you. What data do you collect in each of these areas? Please use the chat box to let us know what data you collect. We will pause to read some of your responses. So we really want to hear what data you're collecting as organizations around each of these important areas. So we're going to talk about some of the examples here. Factor 1, rights protection and promotion. You might consider collecting data from your Human Rights Committee, restrictions utilized, restorations, restrictions approved or not approved, percentage of people attending Human Rights Committee meetings, advocacy, which might be a bit more abstract. You can look at training for staff and people you support, percentages of people with guardians and rep payee, so data around decision-making supports. And of course, there's a lot that you can do with the personal outcome measures in this area as well. People exercise rights and people are treated fairly will all help you to measure your effectiveness in this area of rights protection and promotion. So Betsy, do we have some feedback about what others are collecting in this area?
I don't see anything at this point.
Okay, all right. Well, if you have ideas, please let us know. Okay, so factor 2, dignity and respect. Some data that you might consider collecting in this area. And of course, if you have some ideas, please share. Grievance and complaint data, number of people working in integrated employment settings, percentage of people with keys or other means to gain access to their homes, such as a combination lock or key fob, percentage of staff trained to promote dignity and respect. You can look at people who are employed and earning at least a minimum wage. And then again, of course, the personal outcome measures, there's quite a bit you can collect in this area, such as people are respected, people choose where and with whom they live, people choose where they work, and people choose services.
So Mike, we do have some people that brought up some things. Not always related to this one, but satisfaction survey, to factor 1, number of rights restrictions in place, the type of restrictions, what supports in place, what rights are most important to the person, POMs, and another person mentioned rights restrictions and new and renewed rights restrictions. Let's see, someone mentioned training completion compared to various and incident rates. That's interesting. POM data again.
Great.
That's what we have so far, yes.
Great, thank you everybody. Yeah, great suggestions. Okay, so factor 3, natural support networks. We really want to think about relationships here. So we might look at individualized assessments, volunteering, and reciprocity. We might look at using technology. The personal outcome measures are going to be very handy here for this area of relationships. So of course, quite a bit of the personal outcome measures are about relationships. People are connected to natural supports. People have friends. People have intimate relationships. People perform different social roles. People interact with other members of the community. Okay, so factor 4, protection from abuse, neglect, mistreatment, and exploitation. There's going to be quite a bit here, and I know many of you, or perhaps all of you, are already collecting quite a bit of data in this area, but we'll make some additional suggestions. So you can look at review of incident management committee minutes. You can look at training for your staff and people that you support. Data on allegations of abuse, neglect, mistreatment, and exploitation, the number of allegations and substantiated allegations of abuse, neglect, mistreatment, and exploitation. You can look at data on injuries, both known and unknown origin, deaths, restrictive interventions, data from external reviews, so any state or provincial surveys and audits. And then, of course, the personal outcome measures, people are free from abuse and neglect, as well as people are safe. Okay, factor 5, best possible health. We can look at medication errors. And there's a couple ways to look at medication errors. You can look at a percentage of the total or a percentage of the total of medication passes. So there's a few different ways to look at that. You can look at data regarding people managing their own healthcare. So maybe you want to look at the extent to which people are managing their own medication or scheduling their own appointments, looking at hospitalizations and ER visits, sick days, illnesses. Again, external reviews might come into play on this one. And of course, our personal outcome measure, people have the best possible health. Factor 6, safe environments. There's quite a bit we can look at here as well. review of safety committee meeting minutes. We can look at a review of policies, procedures on disaster preparedness and internal inspections, training for staff and people receiving supports, data on emergency drills, external and internal inspections, again, external safety reviews and audits, and our personal outcome measures of people are safe and people use their environments. And I'll just pause here. Betsy, did anybody else have any additional suggestions for any of these areas?
For factor 5, preventative healthcare tracking.
Oh, I like that. That's great.
Yeah, good one.
Perfect. All right, thank you. Okay, and factor 7, staff resources and support status. So again, you're probably already going to have quite a bit in this area. Hiring and turnover analysis, people supported, family and employee satisfaction surveys, overtime data, staff training records, performance evaluations. It's not on this slide, but you can also look at the extent to which people are involved in all of these things: hiring, recruiting, retention, training, and of course, the personal outcome measures. People experience continuity and security, and people choose services.
And for factor 5 health, falls, reasons for falls, guide our education efforts. Factor 6, work comp claims was mentioned.
Great. Yeah, great suggestions. Thank you. All right, so factor 8, positive services and supports. We can look at restrictive interventions, the usage of psychotropic medication, the usage of PRN psychotropic administration. We can look at the attainment of person-centered goals and the extent to which people are directing the planning process or running their own person-centered planning meetings, training for staff and people supported, incident management data, and personal outcome measures in this area. People choose personal goals and people realize personal goals.
And Mike, for factor 7, someone suggested who participated in interview for new employees.
Thank you. Okay, factor 9, continuity and personal security. So we can look at data from financial reports, your annual fiscal audits, personal money management, operating capital, budget statistics, participation in organizational governance by people receiving supports, families, direct support professionals, community members, and other stakeholders. So you can look at the extent to which people are serving on committees, your board of directors, and the extent to which people are involved overall in the governance of your organization.
Here's a good one for factor 8, Mike. Positive service, the existence or potential existence of quote unquote house rules.
Ooh, that's a great suggestion. Love those house rules. All right. And now we would like to share a perspective from one of our partner organizations. We are excited to introduce Josephine Bailey. Josephine is a senior director at the Arc of Lexington, overseeing community supports, quality, and compliance. She has been in the field for nearly 30 years, with over 11 of them at the Arc of Lexington. The Arc of Lexington is located in the foothills of the Adirondacks in upstate New York. Their mission is to empower people with autism and disabilities to live their best lives every day by partnering with their families, employees, and community. The Arc of Lexington is an innovative agency that constantly monitors the services they provide to find gaps or areas in need of improvement. It is through this careful evaluation process that they are able to enhance existing programs and develop new ones to best meet the needs of people receiving support. All right, so without further ado, Josephine.
Good afternoon. Thanks, Michael. I just wanted to share a little bit about our organization, just to give you a sense of the community that we support. The ARC Lexington is part of the NYSARC chapters of organizations. We have the pleasures of spanning Fulton, Schoharie, and Albany counties in upstate New York. We recently merged with Schoharie ARC, which gave us nearly 1,800 employees that we work with, and we support over 1,000 individuals, starting at birth with our early interventions program, and then from ages 3 on up for all of our other services, supports, and opportunities. We have also a community arts center open to all ages and our community, and a transitions program that's designed for young adults to transition from high school to either college or their career choice. For us, data is important, and we use it to continuously assess our supports and the level of satisfaction that people have with the supports that they choose from us. The data that we collect has really helped us continue to modify, tailor, and develop our supports that individuals need or seek help in achieving their goals. For example, nearly 7 years ago, we completed a workshop transformation because the data was showing us that individuals desire to be community-based. So we transformed it into what we call a Good Neighbor program. It's based on community involvement, volunteering, and job development. We also saw a need for high school students that were struggling when they graduated high school and were not successful in college or the work setting. So we developed a college and career program in collaboration with the Vanderbilt Institute and Georgia University, were just a few examples of who we collaborated with. And we used curriculums that were already developed and had been tried to be successful, like the PEERS curriculum. And this was designed to help students build those social skills and executive functioning that they needed to be successful in both either college or the career and work path that they were choosing. To help with our overall system, some of the areas that was touched upon in the presentation, we created what we call a CQL leadership team. It's made of a cross-agency key staff and to ensure that the whole agency is represented. This team meets monthly, and we have assigned leads from this team that has direct oversight of one of the basic assurances. And then we rotate 2 basic assurances per month that we present on at this team. The purpose of it is to always continuously be looking at how are we meeting the basic assurances, what supports do we need to continue working on, what do we need to change. We also utilize the POM data, and from the POM data and the basic assurances, we developed our quality indicators. And we choose our quality indicators based on the data that we've collected. We also have a small POM committee. The purpose of this is to take what we're learning from the POMs and to dig deeper into that data and then identify areas that we as an organization may need to add additional support or perhaps locate or develop a training program to help people gain whatever skills or supports that they're looking for. And then we have a team of directors. So we took a directors meeting and we revised it and created a level 10 meeting. This group meets every 2 weeks and focuses on key indicators that are the most pressing at the time that we're working on. So for instance, DSP vacancies and turnover certainly is a high factor right now for our field. So that is a top priority. Along with safety and our nurturing environment program. This gives us an opportunities for this group to focus on those high key priorities that need more immediate attention. It also puts a director in the lead of them seeking input from the people we support and our staff and our stakeholders so that it is an agency-wide collaborative effort on how do we achieve the goals, resolve the issue that we might be facing. So we didn't necessarily recreate the wheel. We took some of those meetings that are already happening in organizations and basically reshaped them and focused based on data that we were collecting. So we collect data that spans from demographics and finances to our oversight agencies that come in and complete surveys, goal achievements. We take a look at medication use. We take a look at the number of PRNs that perhaps are being used. We had a high focus on behavioral supports and what type of restrictive interventions or restrictions were being implemented. Key POM areas that have been identified that have lower supports. One of the highest that always comes out is people wanting to work. So how can we increase those numbers within our community? What supports do people need to be able to obtain the job that they're looking for? And all of the people that we support to obtain employment are employed at minimum wage or higher. And that was an important factor of the data that we collected from the people we support. So that is a large focus for us. The CQL leadership team that I spoke about looks at the data and relies, on quality assurance staff and nursing and clinical. We have certified POM interviewers and trainers, and we work as a team to help analyze data more specifically. It can also be, members of our committees that we have. We also have stakeholders involved, like our safety committees, our nurturing environment committee. Is an open forum meeting that happens monthly that includes people we support, staff, family members, board members, and members of our community. So that is a perfect opportunity to have collaboration of all of our stakeholders. We found that we can add supports, where we seek areas in need of improvement. Follow-up has shown, efforts to be working on the POM data. We compare, so we start with a baseline and then compare the data. Are we reaching those supports, increased supports that people have asked for? And making it a monthly topic. So our nurturing environment, which is really kind of the hub of our organization, if we have learned of an area that requires more supports and more attention, then it becomes the topic for that monthly open forum meeting, so that collaboratively as an entire organization, we are working on those key areas that our data is showing us. We have our quality indicators are based on the basic assurances. So each area of the basic assurances has identified quality indicators. And then from the quality indicators, we develop the leadership scorecard. So on an annual basis, at the beginning of the year, we review the previous year. We review our data. We review our quality indicators that's based on the basic assurances. And from there, we identify the leadership scorecard, which are the highest, most pressing areas that we need to identify. Safety has always been a top priority for us. So reductions in injuries to people we support, reductions to our employees, supervision levels. This is an area where organizations often will put in enhanced supervision levels for safety reasons, and inadvertently you end up restricting people's ability to freely move. So that's an area that we felt we wanted to tackle. Family concerns. So we don't just solicit and track complaints from people we support, but also from families. And obviously, as we're facing the crunch with DSP vacancies, we want to monitor areas where how our minimum staffing levels doing, how many vacancies do we have in each areas of our county. Abuse and neglect, always a top priority. And then of course we're audited by our state auditors, so it's important that we maintain little to no statements of deficiencies from our state reviewers. So this is just an example of some of the areas that we chose and who's going to be reporting on it, the frequency of the report, what our current results could be, And then we use a green, yellow, red stoplight system because it's at a quick glance you can see which areas we're not meeting our targets. So those are some areas in how we involve our staff, our people we support, our stakeholders, our community. It all stems from our mission, our vision, and our values. And from there, we continue to improve, change, and tailor those supports that people are looking for. Thank you for giving me the opportunity to share a little bit about the ARC Lexington and how we use data to continue to analyze and improve our organization. I don't know if there's any questions, or I'll turn it back over to Michael for his presentation, or Betsy.
Thank you so much. Thank you. So we are running a little bit on time, slow on time, out of time actually. So help links on our website, accreditation overview, options, inquiry forms, staff are posting them on our Q&A chat, portal system, accreditation success stories, good stuff. Go ahead, Mike. These are the references. We used a lot of information about storytelling, data points. These are some really great resources. And I'm not going to recommend one over the other because you should experience and be exposed to all of them. That's only 2 E's, but so we're doing accreditation preparation on 9/22/21, and virtual accreditation will be announced. Don't forget to connect with us. We are on Facebook, Twitter, YouTube, LinkedIn. We post a lot of our resources, articles, and other information. Don't forget to join eCommunity on Facebook so people can share information and resources amongst each other. And please email Mike or I any questions that you may have in regard to today's webinar. It's a lot to talk about with data, and we appreciate you hanging in there and learning some things. We try to do a little bit different spin on data and how you collect it, and we always ask organizations for stories. So this is a really great way to speak about data. Tell a story. Thank you so much. Any questions? We have just a couple minutes. Michael, what do you think?
Okay, let me just look here.
Oh, someone wanted to know how many palms they complete.
Well, it depends. How many palms do you complete per year? Well, what we would recommend, Deborah, is that you do a representative sample of people in your organization. So depending on how many people you support, that may look different, but the important thing is that it's a representative sample so that you're capturing a broad, diverse sample of the people that you serve.
Yeah. And Sarah said one of our favorite finds, obviously, storytelling with data. I love that. There's also a practice book there. And she does reference the data points book, and also another book that we use for one of our resources. So thank you, Sarah, for sharing that. I too enjoyed that. And you'll get a copy of the PowerPoint. It eventually will be, it's been recorded, and you'll be able to have access to that. I'm not sure, maybe in a few days or a week, probably a week. You'll get a copy of that. You can get that from our website.
And the recording of the webinar will be archived on our website as well.
Yep,